You put them on a sheet of paper, the patients are at one end, the doctors are at the other, and all of these institutes, agencies, and bureaucracies are in between, literally not helping you to get your health care, but preventing you from getting it. It's very ominous, and it is a graphical representation of what this bill is about.
Is that also on your website? That are you explaining that in detail on your website?
Yes, we do have it on our health page. You can access it from restoreamericanliberty.com. On that home page, we have a healthcare action center, which is on the left side of the page. Again, restoreamericanliberty.com.
Now,
I'm concerned about what I heard today on C-SPAN when this person was talking. I tuned in the middle of his conversation, so I don't know his name. But what he was saying is that he said they're locked in the room now talking about it. It's supposed to be bipartisan. How can you be bipartisan when you lock the other person out of the room? Anyway, he said, but he did know that it had gone to 15 pages, and that there's going to be a certain amount of money, trillions amount of money cut from Part A, Part B, Part C, Part D, and it's going to be called Part E. Well, that's just an extension of Medicare, so where's the reform? I don't see any reform. You don't reform something by adding something to it. You make a change to it. You make it become something else. And I don't see that. I'm puzzled about why they call it reform.
Else that they haven't included, because what is this Chinese, the one who was hurt in Tiananmen Square incident, and it was on TV, Fang Zing, it was on TV this week.
I
where
didn't see that.
You know, he lost both of his legs
Oh,
in
I
this
heard about
Tiananmen
that.
Square thing, and he had to wear these prosthetics. Well, they said these prosthetics cost maybe like $100,000. Now, here's what I'm trying to say. They haven't said anything about what this health care plan would do for people who need expensive
disabilities.
prosthetics or pacemakers, open heart surgery. What are they going to do about that kind of stuff? Are they going to say, well, we can't do you, or because those are expensive things, expensive surgeries, people who have no limbs, people who may have to have extensive heart surgery, or it's like me, I've had aneurysms, and you're going to pay for that kind of stuff. Are you going to pay for clipping aneurysms, and are you going to pay for they never mention serious stuff that goes on in hospitals.
Absolutely.
well, they do mention, especially dealing with the elderly, so I think the philosophy would be going in that same direction because, for instance, and even Betty and I, we read up about Dr. Ezekiel Emanuel, who's the brother of Rahm Emanuel. Dr. Ezekiel Emanuel was one of the architects of this whole thought process. He indicated that those over 60, 65 really don't serve a productive value for society. And
so then you wouldn't get the health care then.
Yeah.
it's like
you wouldn't get health care.
people suddenly are being looked at and treated like an economic
Commodity,
value.
basically. Yeah,
Commodity.
exactly. And there's this very simple word for this, Mary Ellen, and you know what it is? It's called rationing. The provisions you're speaking about, which are promoted by Ezekiel Emanuel, the brother of Rahm Emanuel, those provisions include what we call age-related dispensing of medical services. For example, that plan advocates that people near middle age and approaching end of life should receive less medical benefits, less treatment, less drugs, and basically that's a form of discrimination, although they don't look at it that way because they have the mistaken notion that, well, you were once young and you got the same treatment that young people deserve, and now you're old and you don't deserve very much treatment, and that's blatantly wrong. That's against everything that America stands for.
And
they're old themselves. That's what gets me. I see this old man come up there to the table and talk and say but should not be done for elderlies. I said, well, does that include you?
Well, he has the
I mean,
Cadillac
are you
plan.
going to restrict?
Really?
Exactly.
Are you going to restrict
Exactly.
his maintenance treatment? He says, how long should a person stay on maintenance? Well, if they're being maintained and they're still doing what they're supposed to do, I'm not talking about people who are staring at the wall. I'm talking about people who are active in their old age. You see,
Sure.
everybody isn't staring at the wall and sitting in a rocking chair. I know I don't. So and so there's a lot of people like me that still keep going. You know what I mean? So we should be maintained if that's what he's going to call it, because I have to have blood pressure medicine or have something for my glaucoma. He calls that maintenance. So I wonder how much maintenance he was
And
on.
then they
you
don't
know.
say anything about terminally ill people.
We weren't talking about term. We just talking about people.
I'm talking about,
Yeah.
I'm talking about young people who might be terminally ill, need lifelong medical services.
Well, they
They
talk
don't- they
about
don't
what they call assisted suicide counseling,
Yes.
end-of-life care, end-of-life counseling. And I can share this. I had taken this summer an elder law class, and we all were required to do a paper at the end of class or the end of the term that was on end-of-life issues. And essentially, I was the only one who was not for assisted suicide.
Really?
So I do know the veterans, for instance, this summer, in July, a letter was sent out from the White House to go to the Veterans Administration, to go out to all veterans about, and it's a little booklet, and I heard a veteran who went in for gallbladder surgery. He was given it, and he said the woman who gave it to him there at the hospital was very pushy. He just threw it in the garbage. But it had questions like, well, do you feel your life is worth living? Do you feel you're a burden to your family? Well, all that leads up to the conclusion, do you want to consider assisted suicide or not? And it's like, well, here's a pill.
Exactly. And it comes at a time in a person's life when their health problems may prevent them from thinking clearly and from understanding the ramifications, both moral as well as financial, that such decisions involve. This is a blatant intrusion into the process of healthcare, and government has no business going in those places.
I do know that one of the objections I have is they will not even consider tort reform. And I just heard, I had seen something on the internet today. With tort reform, $54 billion could be saved over 10 years. But the reason they don't want to consider it is many of the tort reform attorneys contributed to the administration's being in office.
Absolutely, Mary Ellen, you're correct about that. And it's not just the tort reform that's necessary to really, truly transform healthcare to make it better able to serve everyone in America. But in addition to tort reform, as Mary Ellen has said, we need other things. We need insurance portability and
Insurance
portability. Yes,
portability.
we
When
need
you
we
say
need we need the.
insurance portability. What do you?
Well, for example, if you work for a company right now and you leave that company, you lose your health care.
Yeah.
And we should allow people to have health care portability so that when you move from job to job, or if you're out of the workforce for a while, you're allowed to keep your health care and pay it on your own. That way you don't lose your health care, and you don't have to re-enlist with health care wherein you may have an issue with pre-existing conditions, for example. Another thing that would really help to lower costs and improve competition would be to allow for people to buy insurance out of state. We need to change the legislation and to enact laws so that you can purchase health insurance across state lines. That would immensely improve the choices that are available to you. You would have hundreds of health insurance companies to pick from, instead of just a few that happen to be existing in your own state.
Now, what do you think is the real reason behind all this concern about health care? I mean, what I'm trying to say is that, I mean, we as Americans, we see